Unit 5, Lesson 5, Diseases and Disorders of the Cardiovascular System. As with all of our systems, with a little care, luck, and genetic luck, many of us go through our whole lives with the cardiovascular system working well right up until the end. We're going to spend a few minutes looking at one of the major things that can go wrong. Coronary artery disease is a major disabler and killer, especially in rich countries such as ours. There are many lifestyle choices which can lead to or prevent coronary artery disease, including smoking, diet, and exercise. The coronary arteries and veins are the small vessels that launch from the proximal aorta and return deoxygenated blood directly into the right atrium and lie on the outside of the heart to supply oxygen and nutrients to the hungry, hard-working cardiac muscles. When these small arteries become clogged, usually with fatty cholesterol deposits called plaques, we develop coronary artery disease. In its milder stages, one can develop exertional angina. This happens when you're asking your heart to exert itself, but its own circulatory system isn't up to the job. This can result in shortness of breath and chest pain. In this situation, muscle tissue does not die. Instead, the muscle is temporarily deprived of sufficient oxygen, which causes the symptoms. As the disease progresses, it will take less and less effort to bring about the angina. Ultimately, if a major coronary artery becomes clogged, cardiac muscle tissue actually dies, and that section of the heart can no longer contract normally and help the heart to pump. If not addressed, a heart attack or acute myocardial infarction can quickly lead to death. When coronary arteries become clogged, there are two common procedures performed to correct the problem. The more invasive procedure is a coronary bypass procedure. This is called a CABG, or coronary artery bypass graft. In this procedure, using either veins harvested from the patient's leg or synthetic grafts, the surgeon will bypass the blockage to allow blood to flow past. The less invasive procedure is called angioplasty and involves opening the vessel from the inside and placing a stent inside it to keep it open. In this procedure, a catheter, which is merely a thin tube, with a deflated balloon and possibly a collapsed stent, is passed into the body through an artery in the groin, or sometimes the arm. Using X-ray guidance, it is passed up through the artery and into the coronary arteries and to the narrowed area. When correctly positioned, the balloon is inflated, crushing the plaque and opening up the coronary artery. The balloon is then deflated and the catheter is withdrawn. If a stent was used, when the balloon is deflated and withdrawn, the stent remains behind. I've included links to good articles about coronary artery disease and several of the other major cardiovascular diseases and conditions. After you've checked these out, please go to the resources link to your right, check out the review, and complete the exercise. That's it for the cardiovascular system. See you in class.